Hi, I'm Dr. Xaviour and I'm here with the textbook of clinical anatomy, which includes three main topics: osteology, radiology and surface marking. And I have a co-author for this book. She is Dr. Sheetal Joshi. She's a professor at Lady Harding. Why we thought about this book is we have these topics: osteology, radiology and surface marking scattered around all the volumes of the gross anatomy text, and these are the three topics which we usually get for the Viva section. Okay, so the students find it difficult to carry all the textbooks when they come for the Viva. So that is the thought behind having a concise book covering all the three important topics like osteology, radiology and surface marking. So that's the first and the foremost point, the reason for combination of these three topics. Then we would like to highlight how we have compiled this book. So it begins with a competency mapper where we have aligned all the topics, all the important topics which should be covered under these three topics: the osteology, radiology and surface marking from the recent curriculum. Then every chapter starts with a column called anamnesis where we will be discussing a detailed clinical scenario. All these are real life clinical scenarios and the photographs are real images which we got from the clinicians, and we have discussed this topic, this clinical scenario as question answer format. Then we have included all the real bone images in each chapter. Under osteology we have the images, we have the real bone images as well as the schematic diagram of the same image, so that it will be very easy for the students when they have the real bone in their hand. They can easily correlate with the schematic diagram, because most of the osteology books have only schematic diagrams. So they always find it difficult when they get the real bone in their hands. It's very difficult to correlate which are the parts of the bone with respect to the schematic diagram. But here we have aligned the real bone image along with the schematic diagram, so that they will find it very easy. Then at the end of each chapter we have a section called Klinische Perlen. Again it will be covering the clinical details or clinical concepts of that topic. Then we will be having question answer sessions, mainly MCQs, because recently most of the universities are having MCQ format, and we are also going to have next exam where the students will be having MCQ sections. So these MCQ sections of every chapter includes the clinical images as well. So this will be really helpful for the students as well as postgraduate students. Then the next topic is radiology. Again, in radiology we have included the real x-rays, CTs, MRIs. All images are real and well explained and well labeled. And the surface marking also, we have incorporated all the images so that it will be very easy for the students to go through each and every topic in detail. So these are some of the images. All these are real images which we got from the clinicians. So I hope this book will be a very useful book for the faculty, for the undergraduates as well as postgraduate students, because usually we get all these topics with the images mostly in the schematic format, but this is a book where you will get all the images in its real form, the real clinical images of the bones as well as the x-rays as well as the CT, MRI. So all these are real clinical images. Okay, thank you.